Before the surgical procedure, all the basic parts and components must be inspected for functionality. This is done by ensuring the surfaces facing the patient are smooth, as well as free movement of all hand wheels. Now assemble the front support, ensuring that the openings in the pad holders are pointing upwards. This hip fix model is equipped with single-use soft foam pads. It secures the patient laterally in a variable angle relative to the operating table's surface. Insert the single-use pads and secure their position. Repeat the same process for the back support and assemble. The device is also very suitable for the support of a larger patient, especially where excessive abdominal skin could be a hindering factor for good positioning. The rail clamps should be checked for wear and correct fit to the side rail. There are rail clamps available for all side rail dimensions. Mount a rail clamp on each side of the operating table aligned with the greater trochanter of the patient. With the patient supported by an assistant from the front side in the lateral position and slightly angled forwards, begin by mounting the back support onto the rail clamp. With the patient supported by an assistant on the back side in the lateral position and slightly angled backwards, mount the front assembly onto the rail clamp. Release the lower hand wheel. Palpate the lower iliac crest and slightly depress the mattress with one hand and push the pad against the area before tightening the hand wheel. Next, palpate the upper iliac crest and release the upper hand wheel in order to adjust for the correct position of the upper support pad. Then, tighten the upper hand wheel and support the patient in the lateral position from the front. For support at the back of the patient, adjust the height of the post, release the hand wheel, push the back support pad against the patient's sacrum, and tighten the hand wheel. A final check of the pad position and the stability of the patient completes the positioning procedure. To complete the procedure, make sure that you support the patient while first removing the complete rear assembly and rail clamp. Removing the front assembly should be done with the patient supported. Lift the assembly and remove the rail clamp. Visually inspect the patient's skin relative to the pad applications and report any pressure marks that are not acceptable. Opitek International. Medical devices for the operating theater.